What happens to your body if you eat avocado every day? Avocado is a delicious and healthy fruit that is widely enjoyed around the world. The fruit is known for its high nutrient content, including healthy fats, fiber, vitamins, and minerals. There are many benefits to eating avocado every day, including weight management, improved heart health, and reduced inflammation. However, consuming large amounts of avocado every day can also have some potential side effects. In this article, we will explore what happens if you eat avocado every day. You may consume too many calories. Calories are units of energy that are found in food and are used by our bodies for fuel. Consuming too many calories can result in weight gain, and over time, can lead to obesity, which is a major risk factor for many chronic health conditions such as heart disease, diabetes, and some types of cancer. When you consume more calories than your body needs, the excess energy is stored as fat. Over time, this can lead to an increase in body weight and body fat percentage, especially if you are not engaging in enough physical activity to burn off the excess calories. The recommended daily calorie intake varies depending on several factors, such as age, gender, body size, physical activity level, and overall health status. However, as a general guideline, an average adult needs about 2,000 to 2,500 calories per day to maintain their weight. Consuming more calories than this on a regular basis can lead to weight gain. It's important to note that not all calories are created equal. The types of food you consume can have an impact on your overall health and weight. For example, foods that are high in sugar and saturated fat can be high in calories but low in nutrients, which can contribute to weight gain and other health problems. To maintain a healthy weight and avoid consuming too many calories, it's important to eat a balanced and varied diet that includes plenty of fruits, vegetables, whole grains, lean protein sources, and healthy fats. It's also important to engage in regular physical activity to burn off excess calories and maintain a healthy weight. Explain more on you may experience digestive issues. If you consume too many calories on a regular basis, you may experience digestive issues. Here are a few examples of how excessive calorie intake can affect your digestion. Constipation. Consuming too many calories from processed and high-fat foods can result in slow digestion and constipation. This is because these foods are often low in fiber, which is essential for promoting regular bowel movements. Acid reflux. Overeating or consuming calorie-dense foods can cause the stomach to produce more acid than usual, which can lead to acid reflux. This is because excessive amounts of food can cause the stomach to stretch and put pressure on the esophageal sphincter, which can allow acid to flow back up into the esophagus. Bloating. Eating too many calories can cause your stomach to feel bloated, especially if you consume large portions of food. This is because the excess food takes up space in your stomach, leading to a feeling of fullness and discomfort. Diarrhea. Eating too many calories can cause diarrhea, especially if you consume a large amount of sugar or fat. This is because these types of foods can irritate the lining of the intestines and cause them to produce more water, leading to loose stools. To avoid these digestive issues, it's important to consume a balanced and varied diet that includes plenty of fruits, vegetables, whole grains, and lean protein sources. These foods are typically lower in calories and higher in fiber, which can promote healthy digestion. Additionally, it's important to avoid overeating and to consume moderate portion sizes. This can help prevent digestive discomfort and promote overall health and well-being. Explain more on you may experience an allergic reaction. Consuming too many calories by itself is not likely to cause an allergic reaction. However, if you consume large amounts of certain foods, it can increase your risk of developing a food allergy or experiencing an allergic reaction. Here's why. Intake of high-risk foods. If you consume large amounts of high-risk foods such as peanuts, tree nuts, shellfish, fish, soy, or dairy, it can increase your risk of developing a food allergy. This is because these foods contain proteins that can trigger an allergic reaction in some people. Intake of additives and preservatives. Some processed foods contain additives and preservatives that can cause an allergic reaction in some people. For example, sulfites, which are commonly used to preserve dried fruits and wine, can cause an allergic reaction in some people. Cross-reactivity. Consuming large amounts of one type of food can also increase your risk of experiencing an allergic reaction to other foods. This is because some proteins in foods can cross-react with proteins in other foods, leading to an allergic reaction. For example, if you are allergic to birch pollen, you may also be allergic to certain fruits such as apples, pears, and peaches. If you experience an allergic reaction, it's important to seek medical attention immediately. An allergic reaction can cause a range of symptoms, including hives, swelling, difficulty breathing, and anaphylaxis, which can be life-threatening. To avoid an allergic reaction, it's important to be aware of your food sensitivities and to read food labels carefully. Additionally, it's important to avoid consuming large amounts of high-risk foods and to be cautious when consuming processed foods that may contain additives and preservatives. If you suspect that you have a food allergy, it's important to speak with a healthcare provider for diagnosis and treatment. Explain more on you may experience potassium overload. Consuming too many calories by itself is not likely to cause potassium overload. However, if you consume large amounts of potassium-rich foods, it can increase your risk of developing hyperkalemia, which is a condition characterized by high levels of potassium in the blood. Here's why. Intake of high potassium foods. Consuming large amounts of high potassium foods such as bananas, tomatoes, avocados, spinach, and sweet potatoes can increase your intake of potassium. While potassium is an essential mineral that is necessary for many bodily functions, including muscle and nerve function, consuming too much of it can cause problems. Impaired kidney function. Your kidneys are responsible for regulating the levels of potassium in your blood. If your kidneys are not functioning properly, they may not be able to remove excess potassium from your body, leading to hyperkalemia. Symptoms of hyperkalemia can include weakness, fatigue, muscle cramps, nausea, and irregular heartbeat. In severe cases, it can cause cardiac arrest. To avoid potassium overload, it's important to consume potassium in moderation and to be aware of the potassium content of the foods you eat. If you have impaired kidney function or are taking medications that affect potassium levels, it's especially important to speak with your healthcare provider about your potassium intake. They may recommend that you limit your intake of high potassium foods or take other steps to manage your potassium levels. You may experience nutrient imbalances. Consuming too many calories without paying attention to the nutrient content of your diet can lead to nutrient imbalances. Here's why. Overconsumption of certain macronutrients. Consuming excessive amounts of certain macronutrients such as carbohydrates, protein, or fat can cause nutrient imbalances. For example, if you consume too many carbohydrates and not enough protein, you may not be getting enough of the essential amino acids your body needs to build and repair tissues. On the other hand, if you consume too much protein and not enough carbohydrates, you may not be getting enough energy to support your daily activities. Insufficient intake of micronutrients. Consuming too many calorie-dense, nutrient-poor foods can also lead to insufficient intake of micronutrients such as vitamins and minerals. For example, if you consume too many high-calorie, low-nutrient foods such as fast food, processed snacks, and sugary beverages, you may not be getting enough essential vitamins and minerals such as vitamin C, vitamin D, iron, and calcium. Poor food choices. Consuming too many calorie-dense, nutrient-poor foods can also lead to poor food choices. If you regularly consume these types of foods, you may be less likely to choose healthier options such as fruits, vegetables, whole grains, and lean protein sources that are rich in essential nutrients. Nutrient imbalances can lead to a range of health problems, including fatigue, weakness, poor immune function, and an increased risk of chronic diseases such as heart disease and type 2 diabetes. To avoid nutrient imbalances, it's important to consume a balanced and varied diet that includes a mix of macronutrients and micronutrients. This means choosing a range of healthy foods that provide the nutrients your body needs to function optimally. It's also important to pay attention to portion sizes and to limit your intake of calorie-dense, nutrient-poor foods. If you have concerns about nutrient imbalances, it's important to speak with a healthcare provider or a registered dietitian for personalized guidance. Explain more on you may experience avocado hand. Avocado hand is a term used to describe an injury that can occur when someone accidentally cuts themselves while trying to slice an avocado. This can happen when someone uses a knife to remove the avocado pit or to slice the avocado, and the knife slips, causing a cut or laceration on the hand or fingers. Avocado hand can range from a minor cut that requires a bandage to a more serious injury that requires medical attention. In severe cases, it can even require surgery to repair damaged tendons and nerves. To prevent avocado hand, it's important to take care when handling avocados and to use safe techniques for removing the pit and slicing the fruit. Here are some tips. Use a cutting board. Always use a cutting board when slicing an avocado to provide a stable surface to work on. Use a safe technique for removing the pit. One safe technique is to cut the avocado in half lengthwise, then twist the two halves in opposite directions to separate them. Then, gently remove the pit with a spoon or use a knife to make a small incision in the pit and twist it out. Use a safe technique for slicing the avocado. One safe technique is to place the avocado half with the skin still intact on the cutting board and slice through the flesh in. You may experience skin issues. Skin issues can refer to a wide range of conditions that affect the skin. Some common examples of skin issues include acne. This is a skin condition that occurs when hair follicles become clogged with oil and dead skin cells, resulting in pimples, blackheads, and whiteheads. Eczema. Eczema is a condition that causes the skin to become inflamed, red, and itchy. It is often chronic and can be triggered by factors such as stress, allergens, and climate. Psoriasis. Psoriasis is a chronic autoimmune condition that causes the skin to become thick, red, and scaly. It can occur on any part of the body, and can be triggered by stress, infection, or injury to the skin. Rosacea. Rosacea is a skin condition that causes redness and swelling on the face, particularly on the cheeks, nose, and forehead. It can also cause pimples and visible blood vessels. Dermatitis. Dermatitis is a broad term that refers to skin inflammation. It can be caused by a variety of factors, including irritants, allergens, and genetic predisposition. Other skin issues may include rashes, hives, skin infections, and skin cancer. Many skin issues can be managed with proper care, including keeping the skin clean and moisturized, avoiding triggers such as certain foods or chemicals, and using over-the-counter or prescription medications as directed. If you are experiencing skin issues that are causing discomfort or affecting your quality of life, it is important to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan. A decrease in appetite, also known as anorexia, can be caused by a variety of factors. It may be a normal response to certain situations, such as illness, stress, or grief. In some cases, a decrease in appetite may be a symptom of an underlying medical condition or a side effect of medication. Some common medical conditions that can cause a decrease in appetite include gastrointestinal disorders. Gastrointestinal disorders such as irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), or peptic ulcers can cause pain, discomfort, and nausea, which can lead to a decrease in appetite. Infections. Infections such as the flu, common cold, or other viral or bacterial infections can cause a decrease in appetite, as the body diverts its energy to fight off the infection. Cancer. Certain types of cancer, such as lung cancer, can cause a decrease in appetite due to the production of hormones and other substances that suppress hunger. Thyroid disorders. Disorders such as hypothyroidism can slow down the body's metabolism, which can lead to a decrease in appetite. Mental health disorders. Mental health disorders such as depression and anxiety can affect appetite by altering levels of certain chemicals in the brain that regulate hunger and satiety. If you are experiencing a decrease in appetite, it is important to speak with a healthcare professional to determine the underlying cause and develop an appropriate treatment plan. Depending on the cause, treatment may include addressing the underlying medical condition, changing medication, or using other interventions such as counseling or therapy. Absorption. A decrease in nutrient absorption can occur due to various factors, including medical conditions, medications, and lifestyle factors. The body requires nutrients to function properly, and a decrease in nutrient absorption can result in a range of health problems. Some common causes of decreased nutrient absorption include gastrointestinal disorders. Conditions such as celiac disease, inflammatory bowel disease, IBD, Crohn's disease, and ulcerative colitis can affect the absorption of nutrients in the small intestine. Surgery. Surgeries such as gastric bypass, which is commonly used to treat obesity, can reduce the absorption of nutrients by bypassing a portion of the small intestine. Medications. Some medications, such as proton pump inhibitors, PPIs, which are used to treat acid reflux and stomach ulcers, can reduce the absorption of certain nutrients such as vitamin B12, calcium, and magnesium. Aging. As we age, the body's ability to absorb nutrients can decrease, leading to deficiencies in certain vitamins and minerals. Poor diet. A diet that is low in fiber, high in processed foods, or lacking in essential nutrients can also contribute to decreased nutrient absorption. Some common signs of decreased nutrient absorption include fatigue, weakness, pale skin, frequent infections, and slow wound healing. If you are experiencing any of these symptoms, it is important to speak with a healthcare professional to determine the underlying cause and develop an appropriate treatment plan. Treatment may include addressing the underlying medical condition, adjusting medication, and making dietary changes or taking supplements to address nutrient deficiencies.